Welcome back to the Morning Blend. If you sleep with someone who snores, you know how frustrating it can be. Today, we're going to help you get rid of the snoring without getting rid of your bed partner. Here to help is Dr. Madan Kandula. He is a board-certified ear, nose, and throat specialist with Advent. Good morning.
Good morning.
And we asked people the question, how many hours of sleep do you get on an average night? And a lot of people I know already on Facebook said they would get a lot more if the person they slept with didn't snore.
Oh yeah, that's a big problem.
Yeah, and I mean, it can lead to a lot of frustrations and problems with relationships, I would think.
No, it's a nuisance. I mean, there's nothing good about it, obviously. It's very, very common. So actually almost half of folks in this country snore chronically. So, you know, not just snore once in a while, but snore pretty much every night. And so that's half.
And is that men and women?
Men and women.
Wow,
you know, it's
that's a lot.
It is more common in men, but it doesn't discriminate. So,
yeah. How many people who snore, because we've talked quite a bit on our show about sleep apnea, which is a very serious problem, or can be a very serious problem. How many people who snore, so you say, you know, half of us snore chronically. Right. How many people have sleep apnea?
So basically, to keep the numbers sort of similar, so 50% snore, 5% have sleep apnea. So it's a serious issue. It can be a deadly issue. But most people who snore don't have sleep apnea, and so that's where it kind of gets. A lot of folks sort of get in a trap where they don't think they have sleep apnea. They know they snore, or their partner snores. They want to do something, but they kind of are a little bit leery about some of the options.
And I think there is increased awareness both about sleep apnea as well as the CPAP machines.
Sure.
We've even done a fashion show here with CPAP machines before. That's good, right?
It's good. It's kind of a double-edged sword. It's good in general. So 10 years ago, you know, most people didn't really know about sleep apnea. Most people had no idea what a CPAP machine is. I'd say nowadays probably more. There's certainly many folks who don't, but I'd say more folks do know those things versus those that don't. But a lot of folks get scared off on seeking treatment because they know they're snorer. They don't think they have sleep apnea, or they're convinced that way. They may or they may not. If they don't want to be. They just kind of see it as a game where they're going to be stuck with this machine that they don't want, and so that stops them out of the gate. They just don't want to go there because they think that's the only road that whole sort of endeavor is going to go down.
Well, and I would think that part of your job then is education and kind of informing people if they have a snoring issue that a CPAP machine isn't always the treatment option that's best for them.
Yeah, so I mean, look at those numbers again, but most folks who snore aren't going to end up with a CPAP machine. There are lots of options nowadays, and so that's the thing. Most people kind of don't hear about these other options that are out there for the snorers, and then certainly there are some other different options for sleep apnea sufferers as well.
So to kind of break it down with basics, where does the sound that a snorer makes actually come from? Because people probably have different theories about this. It sounds like it comes from the throat.
It's the throat. It's always the throat, 100% of the time.
Okay.
Most of the time, about 80% of the time, it's coming from the palate, which is the area above the little punching bag back there.
Okay.
About 20% it's more base of tongue, those sorts of issues, but that's where the sound's coming from.
So what are the treatment options then? So
really, we can, as far as the snoring goes, so if somebody's snoring, we can do a lot of things to the throat. There's lots of different procedures we can do nowadays where we can stiffen that tissue so that it's not bouncing around back there. So the sound comes from the tissue that's just vibrating, and that's what you hear. And so we can either stiffen that tissue, and there's something called a pillar procedure, which is where we put little implants into the back of the throat. Those guys are permanent. They're part of you. They're not something that you have to worry about every night or anything like that. Very simple to do, very simple to have done, very effective. So about an 80 to 90% success rate if somebody's a snorer and doesn't have significant sleep apnea. It's a simple sort of thing that can make a big time difference, but you got to seek help to figure that out. For folks above the ladder of that, so snore, maybe have some mild issues with sleep apnea, then we're moving more towards things where instead of stiffening that area, we can actually tighten that area up or remove sort of areas that are really, really kind of flopping around back there. So there's a lot of options throat-wise, and then actually a lot of folks who snore, their issue actually is coming from the nose. So this is the start of your airway here. If it's working for you, your mouth is shut, that tends to hold the back of your throat open. If it's not working for you and you're sleeping with your mouth open, it's definitely going to kind of push that button. So a lot of times it's really, for me, it's really assessing the whole situation. What does their nose look like? What does their throat look like? What's the story that's going on? And then figuring out a game plan that's going to work for them. It's not one size fit all by any means. And so, CPAP is a great thing for those folks that need it, but it's not the only thing. And so, it's really kind of trying to figure out the right fit for each person.
Well, and it sounds like there's some anatomical issues if you're doing some things in the throat or even working with the nose that can kind of help this problem. and a long-term solution
Right.
too to
Sure.
the problem, which is nice.
Absolutely. No, getting to the bottom line of things. Yeah.
And most of those treatments are successful, you find?
Yes, absolutely. Yep. So, that's the thing. People kind of are, back in the day, there really weren't a whole lot of options for snorers. Nowadays, we've got some really good tools that are out there that aren't gimmicks, that aren't kind of fly-by-night sort of things that make a big difference and can make can solve the problem.
What's the first step that people should do if people are watching, they snore, they sleep with someone who snores? What should they do to find help or kind of get started?
Just get in, get checked out. We can see what's going on. We're not going to force you into something that you don't want to do, but we're going to assess the situation, figure it out, and figure out what our options are.
It's great. Here's how you can get in touch with the people at Advent. It stands for Advanced Ear, Nose, and Throat Specialists. They're located on North Mayfair Road. The phone number there for more information or consultation is 414-771-6780. The website is advent.md. And now we're going to head over to